filament acupuncture in the treatment of chronic gout. Okay, so without any further ado, I'll hand you over to Kate, who's going to do her presentation first. So it's over to you, Kate.
Thank you, Susan. I'm just going to share my screen, and that should be up and running now, I believe.
Yes, that's fine.
Can you see that? Brilliant.
Yes.
Lovely. Okay. Well, thank you ever so much for that introduction, Susan. And thank you everyone for tuning in on this quite early Sunday morning. It's really nice to know that so many of you have joined this breakout room. And so just to introduce myself, as Susan said, my name's Kate, and I graduated this year, or this summer, from the Northern School of Acupuncture, which is based up in York. And the brief for today's session was to share my experience of being and learning within the student clinic based up in York. So for those of you who don't know, at the NCA, as part of the college and within the building at the university, we have our own student clinic. We have about 4 treatment rooms, and we have access to be in the student clinic all the way through our training. So in the first year, we have a handful of days where it's mainly observation. And then by the time we get through to the second and third year, we're very much involved in the clinic and running the clinic. And by the third year, we are running the consultations. So just thought it might be useful for people just to sort of know that that's how our college runs it. Like I said, I graduated, or I finished my studies in June of this year. And despite COVID, managed to get everything done, which, as we'll touch on later, was obviously a little bit of a feat, with clinics having to be closed for 15 weeks or more. But part of the reason I was able to finish is that I was able to access, or was invited to take part in a remote student clinic, which meant that for the last 40 hours of my training, instead of being in the college clinic, I was able to work in a practice outside of the college. And I just wanted to mention that really because it was a really integral part of being able to finish on time. So before I graduated, I'd been offered an associate role. So I actually went and did my last 40 hours, which equates to about 5 days in private practice. And what this allowed me to do was to really help with the transition from that being a student to being a new practitioner, which for me was quite a big step actually. It really helped to bring down the fear that I felt about that. Because it was such a big step. And in actual fact, I actually ended up getting more support because I had not only access from my supervisor in the clinic, but also I had my new boss, the person I was working for, sort of right next to me, and she was obviously very supportive and understood that the position that I was in. And also just having that access to 2 settings. I was very used to how we did things in college clinic, obviously, and post-COVID, all the new legislation and ways of practice rather that was implemented there, and then being actually translating that into a real life clinic environment was really helpful, just to spread that experience. So the reason I'm just mentioning it is that if any of students are listening today, if you were offered that opportunity to do some remote supervision, I cannot actually think of a negative that came from it. And I did ask my other colleagues who had that experience, was there anything negative for them? And no one really could find anything. It was only positive. And also for anyone who may be thinking about taking on an associate or a new graduate, again, maybe this is an option that colleges would offer. So it was just to share that experience really as well. So thinking about student clinic, when I was in year 1 and saw it come up on the syllabus, this is where I really thought about where I would be learning. This would be my needling and point location moment. This would be where I'd learn my trade. This is really the active bit. And it absolutely was in year 1 and all through the years. That was very much part of it. However, for me, student clinic was so much more than just doing the needling and the point location. And I'm going to use a case study today just to sort of explore and present some of the themes that I've carried over from my experience in student clinic into my role as a new practitioner. So the themes that I want to explore today, I'm just trying to move a slide down, but it's not moving. I'm pressing. Is there any? See if I can. I can't change my slide, Ian. So
try scrolling it. Try scrolling.
Thank you. Perfect. Thanks, Ian. So the 3 themes that I'm going to be discussing today are labels, supervision, and boundaries. So the first, oh, scroll, not press down. Sorry. I'm just going to move slide again. Oh, it's goes a bit quick. Oh, sorry. Right. Labels, that's the first theme for today, and I'm going to be using a case study, and the gentleman I'm going to be using is a gentleman named John, whose name I have obviously changed for confidentiality reasons. So when I was a first year in student clinic, I was introduced to John by a 3rd year student, and this is how I was introduced to John. I was told that John is a schizophrenic. He has hallucinations. He has been in prison and he's been addicted to drugs and alcohol. Now, if you wouldn't mind at all, I wouldn't mind if people just take a moment to reflect and have a think back to either when you were a new practitioner or a student, or at any point in the past, and just have a think about potentially what emotions you might have experienced if this was the only piece of information that you had about a client. I'm not going to ask anyone to feedback, so just take a moment, just have a brief think. So I don't mind sharing with you that the emotions that I had when I was presented with this information, bearing in mind that I do have a sort of a previous work experience within the mental health sector, was that I was anxious. And upon reflection, those anxieties very much came from things like, was I capable of helping him? Could acupuncture actually help? And would he relate to me? So those were my sort of, feelings where that anxieties came from. So now I just would like to take a moment to reintroduce you to John. I'm just going to move the slide. So John, I'm going to reintroduce him as a 38-year-old gentleman who lives with schizophrenia. He finds acupuncture invaluable for managing his mental health. He's in a relationship, he has a job, and he's absolutely passionate and fabulous when he thinks about the arts and what that means to him. He has found medication that helps him, and he has access to mental health services which he accesses when he needs them. He regularly attends Alcoholics Anonymous, and he feels that alcohol makes his symptoms worse. And he has auditory hallucinations, and he'll tell you about them if they're causing him distress. So the question now is, has your emotions changed? And I really hope that I really hope they have. And this is really just to maybe point out, well, I think we all sort of experience this, just the power of labels and understanding how much stigmas exist. One of the things that student clinic taught me was about the language that we use, and how, if we communicate well about mental health, how actually we can make a positive difference. When we use positive language, we know that then the person is seen and not their illness. We're inclusive rather than exclusive, and it's about being respectful and focusing on people's strengths. And really, when I think about John, this is the case study for today, and when I'm going into practice, I have like this John barometer that I go back to, because as a newly qualified, I've only been in practice now a couple of months, but I have so many anxieties that come around, and I'm sure I'm not on my own with that one. And so translating that into real life, when I think about a new client coming in on a Monday, and I walk into the clinic and I see my patient list, and I say, I've got a GP coming in on Monday. Again, I just get triggered, and things like, they'll be more knowledgeable than me, or they might ask me a question that I don't feel I can answer. I just now sort of try and go back to my John barometer, and that's what reminds me to focus on the person and the symptoms rather than the label. And so whilst these case studies and these examples sort of highlight my own anxieties and insecurities, really at the heart of what I'm saying is that, and what we're taught all the way through our university life, but and also our clinic experience, is that every person or every client is a person with a backstory and not a label or the stereotypes that come with that label. And I was just thinking maybe an exercise that might be helpful for everyone in the next few weeks is just to maybe consider the last time that a label may have caused us any particular emotion, because we're all vulnerable to it, and it might be a positive emotion, it might be a negative emotion, but just notice when those labels just do something to us, and maybe that will help us be enjoy our practice maybe more. So that is the first topic that I wanted to cover today, but that sort of moves quite nicely then into the idea of supervision. I'll just take a moment to have a drink. So as part of the syllabus in York, supervision was introduced very early on, but it sort of became more talked about in year 3, because obviously we were thinking about going into practice. However, all the way through the student clinic experience, it was around, but it was a relationship that evolved. So at first, very much my first year, the relationship with the supervisor was very much, you know, please just show me how to do this. I want to watch, I want to learn. It was really the nuts and bolts of beginning this career. And I remember very much my first year being observer in the room and watching the supervisor in the year 3 do their needling, and John came into the clinic and they needled, did his prescription, then they needled yin tang, and this was my very first wow moment in student clinic, and I love thinking about it now because it was just amazing. And what happened is that John had quite a difficult week. He openly shared with the students what had happened. Then had been needled, yin tang had happened, and you just saw this person go from being quite chaotic and quite stressed and distressed as well, to being the room just went, and he just went very quiet and still. And so the treatment happened, and I was, as a first year student, I was then at the end of the treatment required to look after John, make sure he was okay after the treatment, and ensure that he was safe getting, leaving the building. And during those sort of farewell moments, I took the opportunity just to talk to him a little bit about his treatment, and said to John, how was that? How did you feel? And he described it as he just felt like the volume had been turned down. Which for me just thought, wow, if you've got a week where the noise is very loud, just to be able to have some respite from it was amazing. So that was one of my first experiences. And then that was in year 1. And so I did see John throughout my 3 years at the NCA. But then in year 2, you go from sort of doing a lot of observing to then starting to do things and getting feedback. So in terms of supervision, just moving my slide, there we go. What I found was that the role of supervision really morphed over the 3 years at university. So from year 1, it was very much about pattern recognition. So I was being shown how to recognise liver qi stagnation, or phlegm misting the mind, or damp heat in the low jiao, all those things that, those patterns were coming through. And then in year 2, that was being put into sort of pathology diagrams. But by that point, we were starting to needle. So then I had self-doubt and confidence and all those sorts of things feeding in, which then needed to be looked at via supervision. And then in year 3, we're sort of really fine-tuning into the differentiation of patterns. But then the anxieties of going out into the real world and being an acupuncturist. So really the ability to have these complex cases within the student clinic, but have the supervision to keep ourselves as students, but also the client safe, was integral. And it was also an opportunity really just to normalise fears and concerns as we were going through the course. And I think really what it did do is supervision in itself really prepared me for the real world. And so now when I'm out in practice, it's about knowing when I need to ask for help, or when I need to ask for support, whether it's about a case, whether it's about how I'm managing my workload. And that sort of really was fed through all the way through student clinic. And what is interesting is that when we look at other professions, so I was an occupational therapist, so I've come through the NHS, and supervision is completely and utterly embedded within the NHS, as many of you will know. And trusts, you know, they are assessed by the CQC on their adherence to this commitment to supervision. And so it's just really, I think for me, really important that it is really begins to get embedded in my own practice. And as I've, you know, just at the very beginning of my acupuncture career, I just thought this slide for me really represents where I am at the moment. So I'm on this side of the bridge, and I see all these amazing practitioners and acupuncturists on the other side of this bridge. And I look to them and think, wow, you know, I hope one day I'll be able to do some of the, you know, some work similar to that. And how I see myself getting across there is probably obviously experience and putting the time and the effort in, but also supervision, because I feel that it's really important way to move from one end to the other. And I feel like it's much harder to navigate without it, because I feel like if I was on this side of the bridge without supervision, I'd probably go down under the canyon. I'd try and work my way through the trees, and then come up, scrabbling up the side, trying to find a path. Whereas supervision, I feel like my supervisor has this aerial view and can see a little bit of where I am and what I'm doing. And so they can sort of help navigate, and they give me a different perspective on where I am at, all in all, and just help me build these little wooden planks that'll eventually help me get to the other side of the canyon. So that was just a bit of a visual of how supervision has been for me over the university clinic time, but also how translating it into what is now my sort of new profession. So yeah, so that's sort of what I want to say about supervision. And then finally going on to the idea of boundaries. And what I sort of was hopefully showing by this slide was that boundaries are, you know, they're varied. They're not in a straight line. They can become very blurred, and they do need some exploration and, you know, some time giving to them. And interestingly, you know, they do come in many different guises. So for example, it may be as simple as someone in clinic asking, you know, which school my children go to, or where I've travelled from today, to things like enforcing cancellation policies, or taking on too much work, whether it's either in my professional life or taking too much on socially or at home. And now sort of going back to the case study with John, that idea of boundaries did pop in at times. So, you know, I over the time at student clinic, you know, that was a 3-year experience of working with and seeing John, and bearing in mind he was coming in for weekly treatments, you know, that relationship does build. And one day he came into the clinic and he was absolutely buzzing, completely delighted with the fact that a piece of work that he'd done had been accepted into an arts festival. And I just saw this radiance shining out of him. You know, something he'd done had been accepted, he was being paid for it, and the sort of concept of self-worth, you know, you could just see it shining through. So I was delighted, and we shared that joy together. And at the end of the treatment, he invited me to attend the festival. And I'm sure situations like this aren't uncommon for many practitioners. But all I can say is that my antennae just picked up a little bit, and my instincts kicked in a little bit. And I thought, this needs to be thought about. And interestingly, you know, it was supervision. It was going back to my supervisor, just talking it through, which really then helped me to separate my heart from my mind. Obviously, even in Chinese medicine, we wouldn't really separate the two, but it just helped me get an idea of what I needed to do. So really, just to say within this topic is just that it's really helpful to have a nod to boundaries and just to check that they're intact. So finally, just what I wanted to fill in any of the gaps about the case study was that just to say that John has been attending the student clinic for about 5 years. And like I said, he does, when he can, he comes weekly. And in his words, it saved me. That's how he describes it. And during the pandemic, as everyone else will have experienced, we had the student clinic closed for about 15 weeks. So if you're coming every week, that's 15 treatments that you've missed out on. And as soon as the clinic reopened for urgent care patients, John was booked back in. And the reason I'm just highlighting that was just because it was such a positive experience as a student to be observing that the mental health and physical health needs were being assessed equally. And it is a moment to celebrate how amazing acupuncture is, in that we encompass both the physical and mental health, because we do the full thing. I think, John, like I say, he says it saved him, but it is part of a package. We're not a standalone. He has other treatments coming in, but it has been hugely beneficial on his mental health and his physical health, actually. And what I noticed, what did enable him to do was that as soon as we were able to treat within urgent care, when the restrictions started to ease with COVID, he was then able to re-engage in meaningful activities and start to come out of lockdown, which has been, and it will continue probably to be, quite an issue for many, many people. So finally, just to conclude, because I'm coming towards the end of my 20 minutes, is just to say this is just a snapshot of my experience in college clinic. The amount of learning, obviously, that I've done from my supervisor in terms of the needling and what we do is huge, but it's also the what I've gained from the people and the patients that we've treated and their circumstances is, when I say, I don't know if I can say it's equally as big, but it's a huge part of it. And also just, to really think about the case study today and think that actually, yes, I've learned how to needle yin tang on John, and yes, I've learned where various patterns, differentiations are within John's case. John has also taught me to look beyond labels and always see the person, to seek guidance through supervision, and to trust my instincts and check that boundaries are in place. So that's my presentation for today. I can hand back over to Susan.
Hey, that was absolutely fascinating. You've really given us food for thought there. Really enjoyed hearing about your experience. Thank you very, very much. So do you want to stop sharing your screen now?
I'll do that.
We will be able to hand over to Sarah. So Sarah Christian, I'll hand over to you now.
Good morning. Okay, I'll just share the screen. 1 second. Is that okay? Everybody got that?
That's it. Yeah, that's brilliant. Thank you.
Lovely. Thank you. Thanks, Susan. Good morning, everybody. It's lovely to see so many. Slightly terrifying, but lovely to see so many of you so early on a Sunday morning. Yes, so I'm Sarah. I'm just graduated in June from TAA in Leamington Spa. I'm studying 5-element acupuncture. So what I wanted to share with you this morning was like a deep dive into some of the work I was doing in my clinical year. So just to share that slightly differently from Kate, we do in the 3rd year, we have our clinic year, and we are mentored a one-on-one relationship with a supervisor for 6 months. So you treat patients with that supervisor, and then the second half you're remotely supervised with the support of your tutors and your supervisor and the college. So so this is just what happened with one of my patients, and using 5-element to treat her chronic gout. So just this morning I wanted to take you through what exactly is gout, some of the treatments that are currently used with gout, a little bit about the research that's around for acupuncture and gout, and then what happened with my patient and the outcomes for her. So before I had ever met my patient, the only thing I knew about gout was this guy. So husband of the year, mead drinking, swan eating Henry VIII. So probably the most famous gout sufferer, and the reason why it's known as the disease of kings. So only really affecting people who are older, overweight men who indulge in fine wine and rich foods. So I had to learn quite a lot about gout because that was literally everything that I knew. So what exactly is it? Basically, there are purines that naturally occur in our body, and they come from certain food groups. And when they're broken down, they create uric acid. And uric acid is usually just filtered by the kidneys and excreted from the body via urine. If there is a buildup of this uric acid or it's under-excreted, then it creates a condition known as hyperuricemia. So you can have hyperuricemia and not have gout, but if you do have high levels of uric acid that remain, they will start to solidify and create these crystals that you can see in the picture. So they look beautiful, but these needle-shaped crystals are what lodge into the joints and cause the swelling and the pain. So it's usually in the big toe joint, but gout can occur in any joint in the body. And when it becomes chronic, so chronic is classified as having 3 or more instances of gout in 1 year. And when it becomes chronic, this is when it is associated with prolonged pain, severe joint damage, loss of mobility, and tophi. So tophi is when the crystals harden and then start to permanently lodge in the joint and then build up and really create the difficulty in mobilizing the joint. So I certainly underestimated how horrible gout can be. Just looking at some of these pictures, if you look at the left-hand side picture and that bottom picture of the toe joint and the finger joint, this is just normal gout. And you can see how tender and painful, and particularly with that finger joint, how difficult it will be to move that joint. The picture's more on the right-hand side of the screen. This is when the tophi starts to build up, and so those crystals keep building up on top of each other, and you can see how that joint is going to become completely immobile and really disabled, and it is going to start to take surgery to remove that. So considering how nasty gout is, it's not surprising that it's associated with poorer quality of life, and patients with gout have an elevated burden for mental disorders, and they show 29% increase in signs of depression and anxiety. It's the most common form of inflammatory arthritis and is actually increasing. It's a lot more common in men than women. It's very rare to see in premenopausal women. But there are at the moment 7% of men over 75 in the UK that have a formal diagnosis of gout, but it's suspected that that's probably a lot higher. And it's also increasingly not being considered just arthritis. There are research now that is showing links between gout and other comorbidities, particularly heart and kidney disease. So in terms of current treatments for gout, it is considered incurable, and the main treatment is very heavily focused on a purine eliminating diet, despite the fact that it's only really 12% of sufferers that actually is caused by diet. Other than that, it's anti-inflammatories, mostly commonly colchicine, which is used when you have a gout attack to eliminate the symptoms or help with the symptoms. Interestingly, they don't even really know how colchicine works on gout. When it becomes chronic, the only other option is uric acid reducing medication, again most commonly allopurinol. So these are medications that you need to take for life and take every day, regardless of whether you've got a gout attack or not. They have some side effects, and if you stop taking them, they have some particularly nasty side effects, along with increases in gout attacks. Despite that, the uptake isn't brilliant. There's 80% of patients miss doses or don't take the medication correctly. So there is some research into how acupuncture can help, and it's a lot of quite positive research. It's mostly randomized controlled trials, mostly from China, and there is very little that actually is 5-element focused or uses 5-element treatment processes. But there is the most interesting one I think I found was a very small case study. It was only 10 patients, but 3 of those patients were actually considered fully cured. So they had no clinical symptoms. They were actually monitoring their uric acid and ESR levels. ESR is an inflammation marker. So they were monitoring those levels, and they both fell within normal range, and everything remained so for 1 year. So unbelievable results, considering it's an incurable disease, that acupuncture could have such unbelievable results. So just taking you to my patient. So she is very, very far from the usual demographic for gout. So she is female. She's only 28. She is tiny little thing. She doesn't eat red meat. She very, very rarely drinks alcohol. She actually first had a gout when she was 18, when she was very unhappy away at university, but wasn't actually formally diagnosed until she was 21. Probably because she was so far from that usual demographic. They actually thought she had a broken foot, so they had her wearing a cam boot for about 3 months before she actually managed to get a diagnosis. She has chronic gout now, so she has an attack or every 8 weeks, and the symptoms will reoccur for 3 weeks. At the peak of an attack, which is 24 hours from the start of symptoms, she does not feel well. She feels feverish and lethargic, very unwell, and is completely unable to walk. She literally has to crawl to the bathroom. She cannot put any weight on her foot at all. She takes colchicine when she has an attack, which has limited help. And she was offered allopurinol, which she didn't want to take anyway, but she's subsequently been told that, yes, she can't actually have allopurinol because it's not recommended for women who haven't conceived or would like to conceive. So in terms of diagnosis, this being 5-element diagnosis, it was very focused on CSOE. And when I very first met her, there was lots of very mixed signs of fire and water, particularly in the colour and her speech. So her colour was her face was very, very sallow and pale, but she did have very, very dark navy blue circles under her eyes. She did have a very watery groan, but then there was also this up and down flicker of fire. I settled finally on fire because of the overwhelming joy that I got from her, and the clincher probably was a scorched odour that I managed to pick up towards the end of the session. I think that there was such a mixture of fire and water in her because I believed her primary imbalance to be between the kidney-heart axis. The circumstances of her birth were really difficult, so resulting in some weak jing. She had quite a significant family history of kidney disease. Both her father and her maternal grandfather both having very serious kidney disorders. There were some interesting things going on, her water and her fire pulses, and she was reporting a lot of anxiety and mental restlessness. She was calling it busy brain, but this feeling that she couldn't be at peace, and I could feel a very scattered sort of feeling from her. That was really what I was picking up from her. In terms of a treatment plan, it was mostly to support her fire, try and realign this kidney heart axis and nourish her kidney yin. There was a spleen heart block that was treated very early on in her treatment with me. I used quite a lot of Ren points combined with the back shoe point, which worked really well for her. And I did use bigger points than I probably would have done in a normal 5-element treatment plan, which I'll explain a little bit more about in a second. So in terms of how we monitored her progress, we used the MyMOP scoring system, which is the My Medical Outcome Profile. I'm not sure about that. It's something like that. It's very similar to that. Basically, the patient chooses 2 symptoms, this case being gout and anxiety, and then one activity, which was this busy brain and this lack of focus, and then well-being is also tracked. The patient chooses the number between 0 and 5, so 0 being the very best, 5 being the very worst. And at every treatment, they score again these areas. So this case study is looking at 10 treatments. So as you can see, and anything over 1 is considered clinically significant. So any change of 1 or above is considered clinically significant. So as you can see, the gout and the busy brain had some great results. Showed some really positive changes. The anxiety and the well-being overall were not showing as good. They were better scored at certain points in the treatment journey, but life was coming at her very fast during this period. She had been made redundant literally the day before she started treatment, and so this was, overwhelming for her, and the lack of income was a huge source of concern for her. Her mom and her stepfather were going through a really nasty breakup as well during this period, and this was also in the depths of the pandemic, which obviously had an impact on everybody's mental health at some point. But her not being able to very closely support her mom was a big issue for her. So I think that definitely had an impact on those scores. So having a little closer look at the MyMOP, as you can see, it took a little while to make any difference. So the first 4 treatments, she would arrive and she would feel like a gout attack was coming and was about to start. So those first early sessions were very focused on trying to keep that gout at bay. And so this is where I used slightly bigger points than I would have done ordinarily. So for example, on treatment 2, I'd use REM points, and on treatment 3, back shoe points, still keeping in contact with the CF. So the back shoe points were the triple heater and the pericardium correspondence. So trying to maintain that link with fire and supporting her fire, but just points that had a little bit more punch perhaps, which finally meant on treatment 5, we had this breakthrough where she had the gout feeling had completely gone. And this was the longest she'd ever gone. We'd managed to push it to 11 weeks at this point where she hadn't had an attack. So this is the longest that had happened for years for her. So she was delighted. At treatment 7, she annoyingly did have a gout attack. However, there was no swelling at all, so she had full mobility and she could put her shoes on and carry on walking. The pain and the length of the attack was significantly reduced. So she was absolutely delighted again. She commented that, you know, if this is how her gout was, you know, she would 100% be able to cope and would be absolutely over the moon with that. There was a gap of 3 months between treatment 7 and treatment 8 because of COVID restrictions and lockdowns. I wasn't able to see her for a little while. So when she returned, I think you can see by the scores again, she was a very different person, not very happy. She had managed to get a job in a COVID treatment centre, but was really unhappy, really felt she didn't know where her life was going, spoke a lot about feeling very lost and just not knowing what she was supposed to do. So I did treat it as possession and did external dragons. What was really interesting was she did have a gout attack the next day following this treatment, but it was along the outer foot, so along that bladder line, which she'd never ever had gout there before. So given that the external dragons use a lot of bladder points, I thought it was really interesting that it had popped up in that location. Fortunately, it was quite a limited attack, but the more positively, the changes that she had in all other areas of her life were huge. She quit her job. She got a new job in marketing, which was like the career that she really wanted to follow. She started sorting her flat out to put it up for sale. Lots of really positive steps forward. So I continue to treat her to date. She's still doing really, really well. Her anxiety has really become a lot more manageable nowadays. She still does have gout attacks, but we are constantly pushing that length of time between attacks further and further. She maintains mobility all the time throughout the attacks now, which was the key thing for her, because she's able to go to work still and live some sort of life, and is not for 3 to 7 days every couple of months completely immobilized. So she's really pleased with how everything has been going. Yes, she was a very early patient for me, so it was such a huge learning curve, and she was a lovely patient to treat, and I learned so much from her. And yeah, we continue to try and we monitor her uric acid levels. We've started to do lately, just to try and do a little bit more targeted treatment and see how the treatment affects uric acid. So yeah, that's everything I've got to say on it, really. Thank you all very much for listening.
Thank you, Sarah. That was absolutely fascinating. It's really interesting to see how you treated this patient. So if anybody has any questions, we have a few minutes. So if you would like to put any questions in the chat box, that would be great. We have a few minutes that we can answer. I have a question. I have a question for Kate. When you finish, hi Kate, when you finished treating, you obviously treated John while you were a student at the student clinic. Mm-hmm. What then happens afterwards? Does he go on to be treated by somebody else within the student clinic?
Yeah, absolutely. We do tend to we often have the same clinic days. So we often start to build a rapport with clients, and the clients like that and they book in on the days. But we're also at the NTA, there is flexibility to come into clinic on different days if you need to. And then we also, it's quite nice because you get to know a patient maybe in the first year, and then you say, oh, okay, my block's finished now. And then you sort of do a little bit of a handover where you sort of say, oh, but so-and-so will be looking after you from then. So they get a little bit of sort of continuity, so you're handing over.
Yeah, that's what I wanted to know, that there was continuity there for him, because otherwise that could be really difficult.
Yeah, it's always handled very sort of, it's quite mindfully that there's often an introduction to the next person, or there's a little bit of handover. And then it's quite nice because you say, but I'll be back in the second year, so you'll probably see me then. And yeah, they get familiar with the way that it works. And obviously he's been coming for a long time, so he sort of understood, yeah, did that. But yeah, it is a real consideration.
Yeah, thank you. Thank you very much. Sarah, I wanted to ask you a question as well about the treating of post sort of, now that you're sort of seeing your client regularly, are you just treating the CF now, or are you looking more sort of treating water within, or, you know, what's happening with your treatments now?
Yes, so it is still very strongly focused on her CF and on her fire. There is a lot of her kidneys. I think the weak gene and this genetic background she has with kidney disorders is strongly affecting the situation. So yes, so there is some water points that are used for her. What has worked so well with her has been this combination of using a Ren point and with coupling with the back shoe point. So those are quite frequently used in treatment with her.
Brilliant, thank you. Well, thank you to both. Have we any more questions? You're getting some wonderful support in the chat. Everybody's thanking you, and they found it really inspiring, and they are really inspiring presentations. It's just lovely to hear how people just starting off in practice are, you know, getting inspired by the treatments that they're doing. So thank you very much to both of you. And yeah, what's this? Somebody has a book. This book, amazing when treating any anti-inflammatory disease, really fits well with your mind-body treatment. Great presentation. It doesn't say what the book's actually called, but there's a link there to Amazon to get the book. So yeah, so really, really good. So that's our presentation finished. So we need to go back into the main room now. So thank you to everybody for coming to this, and I hope you enjoy the rest of your day.
So we need to move.
Yeah, so you need to press the leave room so that then you will go back. So in the bottom right hand of your screen, you will see leave room. So when you press that, it takes you out.
Wrong one.
And Kate, I hope you enjoy the rest of your holiday.
Thank you. Yes, it is. Yes, it's a nice feeling to have done this little thing now. Well, not little thing, but this big thing.